Hello, guys. Welcome to one more episode of MetaCast, the podcast of the Meta-Analysis Academy. Today, I have a very special guest, a really good friend, Eduardo Padrão. Eduardo is going to introduce himself in just a second, but I can tell you he has an incredible story of someone who did residency, MD, and residency from another country, from Brazil, where I'm from, too. He had a great career over there. And then he decided to come to the United States, which he's going to talk about that, the reasons behind it, and what were the challenges, and why he decided to do it. And then he came to the U.S. and he had an amazing career here too. Doing a residency at UConn, great program, University of Connecticut, and now he's a fellow in pulmonary critical care medicine at Massachusetts General Hospital, Harvard Medical School here in Boston. So, Eduardo, so great to have you here. Before I turn it over to Eduardo, just want to say that what we discuss here today reflects only our own opinions. It does not necessarily reflect the opinions of our employers. Okay, so that's an important advice. Eduardo, thank you so much for joining, brother.
Thank you, Henderson. I'm very happy to be here, and thank you for all the help that you gave me during my career. So I'm very happy to be here.
Yeah, it's my pleasure. So, Eduardo, I sort of gave a big overview. Let's start with your background. Tell us where you're from in Brazil, and what was it like, doing medical school there, and what was your career like before you decided to come to the U.S.?
Sure. So, I went to med school in Brazil, University of São Paulo.
Are you from São Paulo?
Yeah, I was born in São Paulo, lived there, had my school there. And then there's no college in Brazil. You go straight to med school. And then 6 years there. I was not that worried about studying a lot. I mean, of course, I was always studying, but my main worry at that time was kind of win the soccer championships because I used to play. So that was my kind of main goal. But of course, I was studying. And one of my last blocks that I had in my internship, because you do internship in the last 2 years of med school in Brazil. It's not like here that you do in residency. I met a guy called André Miranda. He's currently an attending, I think in Texas, urologist. And he was applying for the steps. And then I heard about him, and we had a rotation together, and I saw him studying this kind of basic stuff. I said, well, why are you studying this, embryology, all these things again? And he explained all the process and said, oh, maybe that's something nice. So I ended up applying for residency in Brazil, and I matched in my university, in the Hospital das Clínicas. And then I had a pause. If in Brazil, you can pause your residency and do a kind of an intern year in the Army or the Navy. So I volunteered to go to the Navy. I went to the Amazon forest.
Nice. What was that like?
It was wonderful, totally different experience. I used to live in a city called Manaus, but I did many trips on the Amazon River. I spent around 4 months in the Amazon River. Actually, they have ships, that kind of hostile ships that kind of take care of the population.
Wow.
And then we used to see those kind of riverside communities, and also all the indigenous population take care of them. So it was very mind-opening. So it was pretty nice. I learned a lot. And then you have this pause, and then you go back to your hostel, and you kind of start residency for real. And I was studying for the steps during this process, but not completely sure. And I knew that my university had some kind of observerships and research fellowships that you could do outside of Brazil. And I kind of applied for University of Michigan. They had a palliative care kind of block.
In residency,
during residency in Brazil, to have an observership in Michigan.
And this was internal medicine residency.
Internal medicine, yeah. Mm-hmm. And I really liked it. And then this kind of confirmed that, okay, maybe I should go. And then I did another block at Mayo Clinic. It was nephrology.
Rochester?
Rochester. And it was pretty nice. I really liked the way science, and also teaching medicine, and also taking care of patients, they are kind of together here.
Yeah.
Different from Brazil, I think. there are brilliant people there. Probably the most brilliant people that I've met in my life, they're there. But it's kind of separate, right?
Yeah.
But here it's kind of together. And then I said, okay, this is something I really want. And I kind of finished the steps, the USMLE, everything, during my chief residency.
So you were chief resident in Brazil, and
Yeah.
during that year, you'd study for the
Yeah.
steps.
I kind of studied during residency. I did step 1 during first year of residency, step 2 during my second year, and I finished like my application. And at that time, we had step 2 clinical skills.
Yeah.
So I finished during my chief residency, and the step 3 during my chief residency. And then I applied, and was kind of during COVID. And then I came here, went to UConn.
Congrats on that incredible match. But I actually want to go back to preparation for residency, studying for the steps as a resident.
Mm-hmm.
Like, it's tough. What was it like? You were working a lot in the hospital as a resident, doing night shifts, intensive care unit rotations, and you were studying like first aid.
Yeah, it was very difficult actually, especially for step 1. I had to kind of postpone a lot of times because of like different blocks. I was lucky to have like some elective blocks together, which is kind of similar to here. Like the hours are much better. And then I was able to do it, but I had some like even like healthy issues during the steps because I was drinking so much coffee and studying so much that I had some like arrhythmias.
Oh my goodness, man.
But then after that it was okay. I stopped drinking coffee, but it was very challenging. Now looking back, I think was good for me for my knowledge, because I kind of during residency seeing patients, I kind of study a lot, and I have a good basis of like physiology and pharmacology.
Yeah.
But I wouldn't recommend for people doing that. But I think I learned a lot, and I think studying for steps even after like graduating, I think was pretty kind of made me a better doctor.
Nice. Yeah. That's the thing about these standardized exams. I did my USMLEs when I was a 5th-year medical student. I was an intern, what we call it in Brazil. And I agree. It made me better. Like just like studying for residency in Brazil, like you know what it's like to pass where you passed in the University of São Paulo. And you studied a lot, I'm sure. So those things do make us a better doctor to really know the theoretical basis really well. I agree. And then you matched at UConn. It's a great program. I interviewed there for residency. I don't remember if I told you this. I almost matched there. Not to be tangential, but when I interviewed, I was really torn between the University of Miami and University of Connecticut. I ended up matching at University of Miami, but I loved that program. What was it like when you applied? Having done the steps, you were already an internal medicine doctor already. Did the fact that you had done internal medicine residency, did that come up on the interviews? Were people like positively surprised about it? Do you think that it was a problem? How do you see that, having done residency in another country before?
I think, to be frank, actually looking back, I had the same kind of thoughts about University of Miami and UConn, the same as you had. I was like, oh, which one should I rank first? But I think like during residency, it was I had like very frank conversations and interviews with the attendings and everyone. So I think it makes you're much more mature than like the fresh graduates.
Right.
So it was much easier to have like conversations and interviews. You know what you talk about, you know what you like. You kind of know what you want to do after internal medicine. So I think in that way it was better. But I do feel that for applications, sometimes it's hard because they have the red flags, right? And like I was 4 years out of graduation, and then you get cut out from the beginning, from the when you subscribe to the program. So
I think if it's more time, I think so.
Yeah.
It's different programs may do this differently, but I think, and what I like to tell people, and you can correct me if I'm wrong, is that like if you've done like 4 years, like in your case, and you spend those 4 years doing residency, people would generally see that positively, I think.
I think so. I think they see the positive, and then I think also what helped a lot was doing residency. So like if you keep yourself humble enough to kind of learn. You still like having like the eager to learn and be open to different opinion, like changing practice. I think that if you had a good residency, a strong knowledge, I think people kind of get like impressed with your work, and then I think that's where they kind of realized that I was good in what I was doing. So I think that was the difference. Like, because if you compare like someone that's already internal medicine and you compare with another intern, there's a huge difference, right?
Yeah. Were you, and you were chief too in Brazil?
Yeah.
And I mean, you knew a lot about internal medicine, but you also knew how to teach. Like, do you think that you applied that when you were like a first year resident here?
Yeah, I think being a chief was very good for my residency and for my fellowship. You learn so much, and I don't know if you had the same experience, but you learn a lot of stuff during residency, but a lot of stuff are kind of in the air, right? Because they're not organized in your head. And when you're a chief, a lot of kind of bureaucracy work, but you actually have time to put everything down and kind of organize your thoughts and how you think and actually read the evidence behind stuff.
Yeah.
At least in Brazil, I had this time. It was not very heavy. It was like 40 to 50 hours a week.
Yeah.
So it was pretty good. And also you learn how to teach, right? You have like a lot of workshops and how to teach. I had a course of like medical education during my chief residency. And I could apply that during residency. And then I think that was a big differential.
And so during internal medicine, you were, I'm sure, a great resident. I want to highlight something that you said, which is about being humble. One concern that program directors will have when they recruit someone who's already a cardiologist, you know, in Colombia, in Mexico, and somewhere else in the world, or a gastroenterologist, is that the person will come and like not adapt well to the culture of being a resident. And I think staying humble is key for everyone, but you know, especially if you already have to like sort of prove yourself after having done residency in another country. Would you agree?
I agree. I agree completely. I think, I think what you said was the biggest fear of the PDs when interviewing me, because I remember probably the most common question was, what if you have a patient and your opinion, your assessment is different from the attending? How would you manage that? I remember they used to ask me all the time. And I remember Adriana Kang, I think she finished oncology at Yale. And she also had oncology in Brazil in University of São Paulo. And then she came here that did residency at UConn and then oncology at Yale. And then I remember that her answer was like, that's great, because if the attending disagrees, great, because I forgot internal medicine. I'm an oncologist, so that would be great. And I didn't say exactly those words, but I think like being humble enough and understanding that the systems are different and like things that you do in your country may be completely different here. Many things that are not like right or wrong, they're kind of in a gray zone.
Yeah.
So there are a lot of like, not everything is evidence-based, but most things are kind of opinion-based. And then I think learning different opinions is good and make you grow as a physician.
Yeah. When Eduardo was an internal medicine resident at UConn, that's actually when we met. I started this program, the Meta-Analysis Academy. I had an EKG. I still have an EKG course. And then Eduardo was one of the earlier adopters of the Meta-Analysis Academy. So I just want to take a minute to discuss that, Eduardo, about your research productivity before you became an internal medicine resident and then after you joined our program. Can you talk a little bit about that?
Sure. I think it was something very, very important to my career. So I'm very thankful to you, because I think learning how to do meta-analysis is not only about publications, but also how you read the literature and how you judge even like bias on papers and how you kind of evaluate the evidence that you have. So it kind of make you a more evidence-based physician instead of just using your expert opinion. So it was really like career changing for me and the way I see medicine. So I'm very grateful for what you've been teaching to other people, because I think that's very important. But for my career specifically, I think I had a lot of research in Brazil, but different from here. I remember one thing you said, that when you were at Hopkins, you said like every corner you turn, you may end up getting like a publication or like someone put you in a research or they invite you for a research. In Brazil, it's different. You have to you have to look for research, and even if you look for research, you may start a project and never finish. So I can give an example. I started a project during my residency with an important like Brazilian researcher, and I started during my first year. I finished it when I was at UConn in my second year because everything takes so long, and it was paper chart review and everything. From career perspective and research-wise, being able to do meta-analysis in a few months and in like impactful publications in good journals, I think kind of was very important for my match at MGH. So
Yeah. That's one of the top programs in the country. I'm sure you guys know that, but Massachusetts General Harvard Medical School. Eduardo, you mentioned two important things, the getting the actual publications and the impact. In terms of the impact, I think you have a paper cited by UpToDate, is it?
Yeah.
Which paper is that?
It was one of my COVID research.
Nice.
And I got a bunch. Yeah, it was pretty nice. So when I was a chief residency in Brazil finished in March. And it was 2020, the beginning of COVID. And I met a guy, his name was Victor. And this was before COVID. And he was like thinking about proning people with ARDS when they were awake. And then he mentioned that he was my chief. So I had that in my mind. And there were some papers about it on influenza and post-transplant too. And then when COVID hit, like there was this idea of like early intubation by Gattinoni, one of the important ICU guys. But then I remember about this kind of awake proning thing. And there was a guy that was one of the first COVID, because I was lucky. I mean, not lucky, but I had the opportunity to be in the hospital in Brazil. There was the biggest hospital and the first hospital to have all the COVID cases, like a 2,000 beds hospital that was closed only to see COVID patients.
Wow.
And so we saw a patient and he was gonna get intubated. And then we said, why don't you turn around? You're prone awake. And the guy left the hospital like 3-4 days later without being intubated. And we said, oh my goodness, what's that, right? So I wrote a protocol like for an RCT. And then I sent to the ethics committee, like the IRB equivalent. And they said, no, that's not allowed because this is unethical. The current recommendation is to early intubation and avoiding this kind of patient self-induced lung injury. And then I couldn't do the research. But then people in my hospital, they were already doing that, awake proning people. And then I said, why don't we do retrospective research then? And then we did the retrospective research and was one of the first, I think it was the second that got published. The first one had no controls. And was the first one with control group. And then it got like cited by a lot of people because it was the first one. And then RCTs came and it seems to be beneficial. So that's how I got this kind of, and I don't know why there are RCTs nowadays, but my paper is cited in UpToDate.
That's great. I mean, it's the benefit of being a pioneer. That's really cool. And then just in terms of the number of publications, how many overall did you have, before you applied for this match in pulmonary critical care at MGH?
Mm-hmm. I don't remember exactly. I remember for residency at UConn, I had 3. I had like maybe 5 or 6 abstracts plus 3 real papers. And one of them was a case report. I had a lot of research cooking. They were kind of peer reviewing, but nothing published yet. And then during residency at UConn, all my research from Brazil started to get published. And then I had maybe around, I think it was around 20 publication when I applied to
Plenty
MGH.
papers, and
Yeah.
a few of those were meta-analysis.
Yeah,
Sure.
I think it was like 4 or 5 were meta-analysis.
Nice. And you matched in a fantastic program. How has a fellowship been like? You know, you're now second year fellow.
Yeah.
What's it been? What's it been like?
Oh, it's been great. I'm very happy to be there. It's funny because some people, I was scared initially because a lot of like famous people, very smart people, but actually they're very humble and very open.
Yeah.
Everyone you call by the first name, and they're very close. So I'm very happy about the fellowship. I'm learning a lot, and it's actually very good to be able to be like with a lot of like physician scientists that are kind of excellent at their job and like a great hospital. So I don't have any complaints. I must say that you have to work very hard. Like it's kind of 80 hours, especially in the unit per week.
Wow.
And during consults, it's pretty hard to. But overall, like I don't have any complaints. I'm very happy here, and Boston is great. I love
Yeah.
Boston. It's a wonderful city.
That's a common theme here because pretty much everyone that I invite here either lives in Boston or has spent a lot of time in Boston, and then people just like are so excited about this city. You know, you mentioned something so interesting. When I moved from Miami to Hopkins, I had the same concern. You know, many of my attendees were first author and guidelines, like really important people, and incredibly nice, and like just like amazing people, easy to work with, friendly, approachable, available, like all the great things you'd want from attendees. I've had the same experience here in Boston. So I really admire that in my mentors and the people who I've worked with, that, you know, the higher up they climb in the academic ladder, they still maintain like humble and kind and, you know, willing to help. It's pretty cool. In fact, I think that's part of the culture in the U.S. You were in Brazil, and now you've been so successful here too. And you were in one of the best centers in Brazil, but I think like there's a different culture in the U.S., which is the fact that the people who are higher ups, the first author in great papers and guidelines and societies, they're really actively trying to bring people up, like the fellows. They're really working hard to develop the fellows. And in Brazil and where you were, in many places, there are really great mentors too, but I don't know that the whole culture is like that.
I agree with you. I think not everyone, but in Brazil, there is some places there might be a culture of like, I want to help you, but I don't want to help you a lot enough to grow more than me.
Yeah, exactly right.
So
Exactly right. Yeah, we hear about this a lot. You know, again, you were so successful in Brazil, so successful here. I only did med school in Brazil. I didn't practice medicine there for very long. What are some key differences that you see in medicine there versus here?
Okay, that's an interesting question. I think here, I don't know about med school, but I know about residency, and looking at the interns, I can tell some differences. I think in Brazil, I think at least where I come from, education is pretty strong. I think we do have great doctors there. They graduate with a lot of knowledge, and I would say a lot of practical knowledge. So you know how to set up a BiPAP or a CPAP in emergency. You know how to do some procedures after graduation. You know how to turn on the ventilator and set some like initial settings. You know some like practical stuff, and even like things about monitoring patients that I think they don't learn here. However, I feel that the interns here, their base knowledge, theoretical knowledge, is higher, and they're able to build differential lists that are much longer and have much more details than in Brazil. So I think it's like in Brazil you have more practical knowledge because we lack some of like RTs or some places nurse techs, and you end up doing some stuff like that, and you actually learn how to do those things. But here, I think the theoretical knowledge is higher, and then they are always thinking about differentials and not missing diagnosis, and I think this is one of the differences.
Yeah, I agree with that. I've in the places where I've trained, Miami, Hopkins, and Brigham, I found the quality of the residents and fellows like really strong, incredible.
Yeah, it's very strong. I think it's very balanced here. Like everywhere you go, Doesn't matter like if it's like a top tier or mid tier, people are strong. So
Yeah.
the average is pretty high.
Exactly. I think there's a culture of excellence, and I'm not saying it's not like that in other places. Like I said, I only did med school in Brazil, so I didn't really have a strong career there. But there's a culture of excellence. Like people are uncomfortable when they don't do a great job
Yeah.
because the averages should be great.
Exactly, yeah. And I think also there's something different from residency that I noticed is that people learn how to be more professional, like how to behave more professional. At least I learned a lot, like how to behave and things, how to kind of deal with like some problems with other kind of professionals, and so I think like you learn those things here, and in Brazil I think you don't. I don't know if it's because of the culture of Brazil or is the work culture there, but like at least at UConn and here, I have like meetings with my PD, like my program director, every like certain number of months, and then we discuss about different things, even like being how to get more professional, how to do some stuff, and then they really also worry about your career, and they build a plan to improve your career. And I think in my residency, I was lucky to have that too in Brazil. Like I remember Dr. Patrocínio, Maria do Patrocínio. I had meetings with her like every certain amount of months to discuss my career. But here, I think everywhere you go, I think in Brazil, like maybe Hospital das Clínicas, where I did, is an exception.
Yeah.
I don't think my friends that did residence in other places, they had the thing. But I think here is kind of, they are focused on your career and how to improve that.
Yeah. Eduardo, you are 1 year out from finishing your fellowship, and I think you're probably in a stage now where you're looking for jobs, right? So what are the options for someone who's so well trained like you, pulmonary critical care, one of the best programs in the country? Like, what are the career options? Not necessarily like the actual places and jobs that you've interviewed for or will interview for, but can you just give a sense of like private practice versus academia, doing research or not doing research? And then also like what type of career track do you personally want to do going forward?
So for the first question about the types of jobs available, I think most of us, we are in the J1 visa, I think like you were.
Yeah.
And then we have to do something called a waiver. And this waiver is for everyone. It doesn't matter what kind of like visa you're going to be. It could be H-1B, which is a work visa. It could be the O, which is like for special abilities, or it even could be the green card. But if you're on the J1 by ECFMG, you got to do this waiver. And this waiver is basically you got to go to some underserved area. Underserved means that, my understanding is that the number of doctors is not enough for the region. It doesn't mean that it's somewhere poor or something like that. But you got to go to those places and do this waiver, which is, I think, 2 years, right? 3 years, sorry. And there, unfortunately, like for us that are more in academia, it's kind of hard to find places that can offer that. Some places do, but not every place. So when applying for jobs, I usually like, oh, we want to interview you. And they ask, like, what kind of visa you are. I say, oh, J1 need a waiver. And they're going to say, oh, yeah, our hostel is not in a waiver region. And then you say, oh, okay. Yeah, and then you have to look for other places. Yeah. But for private practice and for making money, people who are kind of willing to do that, like, you can go to, like, some places, like our friend Augusto that went to Montana and was making, I think, like $400,000 a year. It's an opportunity. It's just like 2 or 3 years, and then you can get your green card. But being in academia is a little bit harder. Most people go to private practice, but it's still possible to do academia. Like Henderson is doing academia. I'm trying to find an academic place because that's what we love, right? But I think it's a little bit harder. And the second question about my future, I want to be in an academic place with residents. I work like in private practice in Brazil, like before, And it's nice to be a doctor and take care of people, but I think if I don't have that environment with residents and fellows to teach and discuss cases, I think part of my happiness goes away. So I want to be an academic place. For this waiver, you have to do a 100% clinical job. So if you sign a contract of like X hours per week, these X hours have to be clinical. And if you want to do something else, it has to be like your free time.
On your free time.
Yeah.
Eduardo has actually won some teaching awards in your career, right?
Yeah, I got some. I got like from UConn, I got almost every year. Here, I got 2 as well.
That's incredible. I mean, you've only been here for 3 years.
Yeah.
You've got 2 teaching awards here. That's amazing. Eduardo has mentored many groups in pulmonary critical care in the Meta-Analysis Academy. He's worked with a lot of our students, and I universally received his really strong, great feedback from you. Like you connect so well with people, and everyone loves learning from you. Of course, you were a chief resident too, so I mean, it's clearly a passion of yours. You're really good at it. You've won these awards, so I'm glad you want to stay in that track. You're going to do a lot of great things in your career.
Thank you.
Very good, Eduardo. So, my friend, this has been great to have you on board here on MetaCast. Like I said in the beginning, I want to reinforce this. I'm really grateful for our friendship and our partnership. I know you've benefited from our program, but also you've given so much back. Like I said, being an expert in the program, mentoring a lot of our students. So I just want to take a moment to also thank you for all the great support. Our friendship and collaboration has meant a lot for me in these last few years.
Oh, thank you, Henderson. I appreciate. This is the guy. He's brilliant. He's a role model for all of us. So if there's someone like that you should follow the steps, it's him. So thank you for everything.
Of course. One final word from you on people who are inspired by your story, who a lot of people who listen are already MDs, residents, fellows in their home country, and they are inspired by your story, but they may be worried too, of course, about the uncertainties about abandoning a career in Brazil or Colombia or Mexico or India or wherever it is, and taking that step forward. I'm going to study for the steps. I'm going to apply for residency again and do it all over. What would be your word of advice to them?
I think it's a big opportunity for learning, and if you love what you do and you're willing to learn more, I think it's an excellent path for excellency. And I don't regret at all doing residency twice, and I'm very glad that I did because I could learn a lot. I still think sometimes that only like 2 or 3 years of IM, internal medicine, is not enough because it's so much to learn. If you're willing to do it and you're passionate about what you do, I think, and you want to come here, I think you should come.
Yeah, I fully agree with that. It's a tough decision, right? I mean, a lot of times people have family already, they have their spouses and children, and it's tough. There's a lot of uncertainties behind it, but I've certainly seen so many people who were successful in doing this, doing residency there first, and then coming here. And universally, I think the people who make it, who come here, universally, they're glad that they tried, even though sometimes they have to repeat residency. They're thankful, they're grateful, they're glad that they took that step forward. So I encourage people to do that too, if that's really what their passion is. So this was great, Eduardo. Thank you so much for sharing your great journey. So much more we could talk about. I want to invite people once again to hit that like button, subscribe to the channel, make sure to watch other episodes. And then in October, if you speak Portuguese, make sure to join us for the Medical Research and Career Conference. It's going to be in São Paulo, Brazil. We're going to spend 2 days, Saturday and Sunday, talking about coming to the United States for a research career, for a clinical career, the USMLE steps, immigration, all these research, networking, and everything else. So make sure to join and sign up for the Medical Research and Career Conference. If you want to learn how to do meta-analysis, join our wait list for the Meta-Analysis Academy. Do like Eduardo and his peers, learn how to publish these papers to advance your career. Eduardo, thank you so much again for joining. It's been a pleasure to have you on.
Thank you, Henderson.
All right, guys, so this is it, MetaCast, the podcast of the Meta-Analysis Academy. Thank you for joining.